Hello lovelies and welcome to today's video. My name is Alya and I'm so glad you stopped by. Today we're talking eye pain and what can cause it, different things your clinician needs to know, and how to best utilize that time with your clinician, what to tell them so that they can help you resolve your eye pain issues. I'm so excited to talk to you guys today about eye pain because I think it's one of those super misunderstood or misexplored symptoms that people can have. It's just so ambiguous. What is it? Is it serious? Is it not? And it's also something that I feel like gets maybe a little bit overlooked in the clinic because we're so busy testing for disease that maybe sometimes it's underaddressed. I've definitely noticed that because people come to us after being elsewhere and say, look, I've been dealing with this for 3 years, you know, I've had all these symptoms and no one's ever worried about it. I would always look at my glaucoma, for example. Of course, as long as you don't have any imminent issues that are causing that pain, naturally specialists want to concentrate on things that are going to be long-term side-threatening. And I totally understand that, but at the same time, I don't feel like any patient's symptoms should ever be ignored completely. Now, I can straight away break the silence, break any conspiracy. The number one cause of eye pain is dry eye or some sort of surface irritation. For example, like a little eyelash that's growing in, or an irritation underneath the eyelid. Sometimes the eye itself is okay in terms of dryness, not fantastic, but okay. But the actual eyelid has suffered some surface changes due to dryness over time, and that's causing constant irritation. And obviously, you'll be feeling that, and it's unpleasant. The other thing is people have different tolerances to pain. When you have that same irritation there for 3 years and you're still complaining about it, you haven't gotten used to it being there, clearly it's going away and coming back and rehappening. Otherwise, your eye would have become somewhat, at least, desensitized. So patients will tell me, it used to be a lot worse, I can kind of put up with it now, but I just really don't want to. That kind of complaint. So if you've tried lubricating eye drops and you've tried topical treatments, which I've spoken about before on this channel, talking about dry eyes, so you've done all those things like preservative-free lubricants would be my number one starting point for anything in the eye. Then, you need to be consistent. I have to point out that a lot of the time where people fail to fix their problem is they're not consistent. They use eye drops, which is fabulous, but when I feel it come on, sometimes I'll put a drop in, sometimes I forget. No, guys, twice a day minimum. The more symptomatic you are, the more often you have to use it. If it's preservative free, there's no risk with that. You're not doing yourself any harm. You can't overdose on a preservative free lubricating eye drop. And if it's still not going away with consistent use, then we have to investigate what's really underlying. But the first protocol for an ophthalmologist will also be, or an optometrist will be, to prescribe you something lubricating, a bit like putting a band-aid on a bit of loose skin or a bit of a scratch or something, just to let it heal. And then hopefully over time, if it's a chronic problem, it'll just keep on flaring up and you have to use your drops ongoingly. But if it's just something that needed a little bit of help to heal, it will heal. Other times you get people that have had some sort of inflammatory situation going on. So some people have cornea that are just susceptible to ulceration or susceptible to different irregularities, maybe because of disease or whatever. But often when we assess the eyes, that's the prime opportunity to be able to find such things. Very painful, extremely painful, would be something like an internal inflammation to the eye. Things that are external are usually less painful, or at least come with some sort of redness or some kind of other physical signs. So it's often noticeable. But that's the kind of pain that, even the pharmacist would probably manage, a red eye or so like a little infection or inflammation or allergy, or dry eye or scratched eye, again, often can be managed with lubricants or lubricant gels. If you want to really amp it up with effectivity of the drops, obviously the more viscous what you're using, the better of a band-aid effect it's going to have. Now, occasionally, and this is where things get a bit more interesting, you get patients who say you've got this, like the actual global pain. And I find these patients absolutely fascinating because what causes global pain? The eyeball itself can't feel pain. It's a little bit like headaches. When you have a headache, it's not your brain that hurts. It's the muscles around or the different tissue around the brain that's there to protect the brain, often hurting. The actual brain itself doesn't actually feel pain, and the eye, being an extension of the brain, also has no pain receptors. So how can your eyeball hurt? So here we have to look at things like, are the muscles around the eye undergoing any kind of issue or strain? So are we looking at maybe having underlying muscle problem? So that maybe glasses can help with fatigue of the eye or eye strain, which is causing that sensation of everything around the eyeball hurting. And that's because the muscles infiltrate in a very interesting kind of Union Jack pattern. So there's two, and then and then 2 horizontal as well. So there's sort of 3 on this side and then 3 on this side. So when you get this pain, it could just be that the muscles are a bit out of whack, not really talking to each other properly, and causing strain, which sounds like nothing. It sounds like, wow, I'm going through all these symptoms for something silly like eye strain. Nothing silly about it. It's a significant thing, and it can cause migraines. It can cause all kinds of further symptoms, which is very easily avoidable when you have the right prescription, for example, if that's what the case is. Sometimes it's more severe than that, or something more involved than that. Like sometimes you might have a thyroid disbalance, and that's affecting your muscles. Maybe you have an autoimmune disease, which is affecting your muscles. But these are all things that can be detected by an orthoptist in a clinic, and give you very clear information about what's going on. So definitely press the matter if you feel you're being ignored, or the matter's not being addressed. You really need to sort of say, yep, I'm really just here for that. Everything else you do, but I'm really, really wanting to get answers for that. Now, often these things will need blood tests or other tests that are done by a doctor, which is great, but you just have to have yourself a starting point. Sometimes even the topical diseases or inflammations or issues can also require prescription treatment, and lubricants just won't cut it. A lot of the time they do. And that's perfectly fine. That's very doable. We're talking about finding yourself a good starting point and the right information for appropriate diagnosis. So really, definitely, I guess my point is utilize your clinical staff. The doctors are usually fabulous. I've worked with some really amazing doctors, and still do. But you have to give them the right information, the right tools. So as a clinician, it's my job to find that data that will then let them make their diagnoses, or even maybe partially suggest the diagnosis on the way out. Because a lot of the times, the tests I do, I'm far more revealing than just looking to the eye. I need to give them something to interpret. I need to give them that info so that they can do their job. So definitely, the more you tell your clinician, the better your doctor's job will be. Sometimes when we see a patient with very strange symptoms, we definitely need to start investigating all kinds of possibilities. So make sure that you've documented or made like a bit of a diary of your symptoms. I think that's really, really important, because a lot of the time when you're in clinic, you get a little bit overwhelmed, or you get sort of distracted by the conversation that's happening, or whatever the case, and it becomes a little bit more difficult to communicate what you've been going through at home. So if you get a headache, maybe just pop a note in your mobile phone. We've all got calendars on our phones these days. Or if you're not into smartphones, just carry a little notepad in your back pocket, and make sure that you've definitely written down what was going on that day, what you stressed. Maybe you had an opportunity to measure your blood pressure. That can sometimes help. What was going on? Were you doing a lot of computer work? What was happening before you got that last symptom? Really helps in clinic. The more information we can have to sort of play with or use to interpret, the easier our job becomes. Now, I just mentioned blood pressure, and that's the other thing. Sometimes we get really severe eye symptoms because of changes that are happening around the whole body, so systemic changes. And sometimes they're serious and sometimes they're mild and benign. It's just a matter of, again, just bringing that information to your clinician, not to Dr. Google, not to Professor WebMD. No, just bring it to your clinician. We often, have already seen similar things to what you're experiencing. At the end of the day, as much as we're all very individual, and as much as we definitely don't diagnose one person based on another person's experience, we can definitely piece the puzzle. We can put the puzzle pieces together a little bit better than you having to start from scratch. We're just basically not starting from scratch. We have a little bit of experience there, and we've seen similar things before, so we know at least where to start looking. And then the tools. So I've got color vision tests, I've got prisms that measure your muscle movements, I've got photography that can basically measure out your whole eye to the point where I could make an eye model of your eye based on the data I collect. Like, these are tools that are just so cool. They literally measure out information that is required for a prosthesis to be fitted inside the eye during, for example, cataract surgery. We diagnose macular degeneration and treat and protect the eye against glaucoma progression using these tools. Like, these are not your blogger cameras. They perhaps run on a similar level of technology, but then they extrapolate that data into usable information that we can then use to diagnose and treat you and help you out. And it may take a few goes, so don't be frustrated with your clinician, but it's definitely very doable. Sorry guys, I had to change the way I was sitting. I was just sitting on my foot and it has gone to sleep. Do not sit on your foot. Not a good idea. So once we've ruled out eye strain, we've ruled out systemic global stuff, we've definitely applied some lubricating drops, we've done all the things. The other thing we have to really never ever ignore is stress. Now, it used to be when I was a kid, when the doctor said, oh, it's stress, people like my grandparents, who, by the way, medical background with my grandma, would go, oh, of course it's stress, because I don't know what it is. And you know what? That's still true. Stress is the reason, the cause of what's going on. It's not actually a diagnosis for what's going on. It's just the thing you have to moderate in order for the thing that's going on to go away, right? And stress comes in very different presentations. Me personally, I'm not someone who's outwardly stressed usually. Like, a lot of people have commented, and I never actually realized it until the comments started coming, that I'm just a very calm person normally. But I do have my breaking point. So that, for example, is a personality trait that can actually cause a lot of harm because you internalize your stress. You don't express it outwardly on the people around you, which is great. But then that may mean that you have other inflammatory things going on in your body, because that hormone that we call stress is a cortisol. So similar to when you get cortisone prescribed to you or a steroid prescribed to you to treat immune responses or to calm down immune responses, we have a natural version of that in our body called cortisol. And when we say stress, we talk about the release of that hormone. Now, originally, we were designed with that hormone because we need to be able to get into fight or flight. We need to be able to run away from a grizzly bear or a tsunami or whatever. We need to be able to get blood distributed to the right part of our body for the appropriate response. We don't need to be sitting there with a drink by the beach, chillaxing and thinking about our taxes, and that's what's causing stress. That's not what that hormone was for. We were designed to run. We were designed to get away. We were designed to problem solve. We were designed to pivot and to survive. Nowadays, we don't need to pivot in order to survive. So as a result, these hormones have to be expressing their effects somewhere, right? And that's where we get these health issues. So if to be really, really extreme and really, really ironic, I can say that instead of being eaten by a grizzly bear, we now get diabetes. Like, that's effectively what's going on here. But that's a very, very basic and very blasé way of stating it. But, to make a point. And stress in and of itself is also very ambiguous. What's stressing you out? Are you not getting enough sleep? Are you not having enough nutrition? That is also a type of stress. And you may not even be realizing it. You may feel like you're eating really, really well, but you're not eating well enough for what your body's needs. So one of the biggest things that I like to recommend is supplements or a slight change or modification in diet in order to tackle certain symptoms. With the dry eye, for example, omega-3s all the way, flaxseed oil if you can tolerate it, really, really great. There are certain things you can do. Introducing many more fresh leafy ingredients into your diet. Don't sit there and eat salad, I'm not saying that, but just introduce some variants that will be helpful in your overall general health. That's all you've got to do. I often say to people that give me that face when I say, oh, spinach is good for you. And I say spinach is good for you to everyone because it is. But I'm not suggesting that we abandon our steak and chips and just sit there and eat salad all the time. No. Eat what you like, absolutely, but just look at what your body needs. Listen to your body. And that could be a zinc supplement, for example. That could be, magnesium. I don't know. Everybody's different. Everybody's needs are different. I'm certainly not a nutritionist, but I'm always suggesting to visit your nutrition or revisit your nutrition and see what your body is craving, is lacking, is wanting more of. Last but not least, sinuses. Sinuses, your teeth, your basically your head anatomy. A lot of the time we underestimate how much our head anatomy impacts our eyes. If you've ever had a bad sinus infection, you will know that you'll probably get sticky, runny eyes. You'll probably have a really hard time opening up your eyes. And it's not just because of the pain here and here. It's actually because there is pressure that is applied around the eye area. In fact, during surgery, when we're trying to block the sensation to the eye, we're trying to numb the eye for surgery, the injection actually happens around this area, right above your sinuses. So we have to take into consideration how enclosed or how close together our head anatomy is. Now, this is not talking about headaches per se, we're talking about eye pain. And, whether it's your muscles, whether it's your nerve, whether it's just dry eyes or something a little bit more inflammatory on the eye surface, or now I've also mentioned sinuses, the important thing, and this is the part that I really wanted to hone in today, is to really bring a good report to your clinician, whoever that is. Your clinician is your best friend in these things, and definitely don't forget to tell them everything you can, and be as accurate and precise about things as you can, so they're not looking at zebras, so they can really go, right, that's the important piece of information, let's do something about this to help you feel better. As always, my lovelies, it was really great that you came along for this video. Don't forget to hit like, leave me a comment, tell me what you think, and definitely subscribe. Definitely join this little family for more videos like these, and Tichel Tutorials, and I'm always open to suggestions for more topics and to expand. For more of those topics, please head over to Instagram. There's definitely more variety over there, and definitely check out what's going on in that big creative world of mine. Wherever you are around the world, lovelies, I hope you're having a really great day. I hope you're staying safe, and I'll see you on the next one. Bye.